So the vaccine is, I think, really showing a lot of promise because we've gotten data that shows that the efficacy, that's how well the vaccine works at protecting against COVID-19 disease, is much more effective than what we might have expected. We were hoping to get something around 70%, and the two vaccinations that are being considered for emergency use authorization have efficacy of about 95%, which is really fantastic. I think that bodes well for the potential of these vaccinations to make a real difference for us. Well, because the quantity of vaccinations that we have available is going to be limited, the CDC and the FDA and the State Health Department are all working together to determine what priority groups need to be getting it first. And it's going to be the elderly, nursing home population, healthcare workers, first responders are all the individuals that are going to be really the first individuals recommended to get the vaccination. And obviously we need to protect the caregivers so that we can continue to do our jobs. And so unless you have some serious underlying health condition, you will not, as a parent, be among the first groups of individuals to be recommended to get the vaccination. But once we have plenty of supply, I certainly encourage parents to get the vaccination for themselves. The next question that leads from that is, when is it going to be available for children? And trials in children are only just beginning. We need to prove that the vaccine is just as effective and just as safe in children, because children are not little adults. So we need to make sure that it works as well for them too. I have no reason to expect that it will not be as effective for children. And so it's going to be important to stay tuned for that. Once the vaccine is available for myself, I'm definitely going to be in line to get it. And I will be unreservedly optimistic about its impact for myself and for the rest of us. Well, in medicine, we're data driven, and we have really good data that shows its effectiveness as well as what the safety profile is with the 30 and 40,000 individuals who were involved in the phase 3 trials. And so right now, what we've seen is, from a safety point of view, it's producing some side effects that are very similar to other vaccinations that are routinely recommended, and they're fairly mild. The two vaccinations that are currently under consideration for emergency use authorization require 2 doses. One of them requires 2 doses separated by 21 days. The other one requires 2 doses that are separated by 28 days. It appears that after that second injection, that maybe about half of the individuals have some side effects like achiness and maybe sore joints and some injection site soreness and things like that. But it doesn't last very long. It's generally gone after a few days. We've had the pandemic going on now for about a year, and we've had these vaccines that are under consideration now for about 6 months in the clinical trials. And the individuals who are being studied right now are going to be followed for 2 years after the vaccination has been approved and recommended. So we'll have opportunities to study that. Very good question. We won't really know the answer to that until the clinical trials are completed in children. Sometimes kids require lower doses of the same vaccination that we need to get as adults, and sometimes they get the same dose. With any vaccination, what you're looking for is to get the desired therapeutic point of protecting against the disease at the lowest dose to minimize side effects. So that's what they'll be working on for kids too. So the current recommendations coming from the CDC are that whether or not you have had COVID-19 should not be a determining factor about whether you should get the vaccine, because we do not know how long natural disease will give you immunity. It certainly gives you some protection for a period of time, but how long that lasts, we really don't know. probably because of limited supply, individuals who were shown to definitely have had COVID-19 will probably not be the first ones that will be recommended to get the vaccination if they've had recent COVID-19 disease. But that's getting kind of ironed out right now, and we'll get more specific information on those recommendations in the next several weeks, I expect. I think that it's important to talk about information and how people get information. Unfortunately, there is organized resistance against vaccinations in general and against the program to try to vaccinate the population against COVID-19 specifically. Consumers of this information need to know that those sorts of agenda-driven organizations are working to prevent the end of the pandemic, and so we really need to be very careful and make sure that the things that we're paying attention to and consuming this information are evidence-based things, and these vaccinations are going through the same and even greater rigorous processes that all the other vaccinations that we have gone through. And so I have every confidence that this is going to be a game changer for the human population. We just need to get the job done, get people vaccinated, and people support that effort. This is our way forward to try to get back to normal. It's not going to be an immediate thing, but it's going to be a lot quicker now that we have such effective vaccinations. And it'll take some time for us to really get back to normal as we know it, but we're getting there.